Welcome to my PowerPoint presentation on the human skeleton system, and I hope you learn valuable information and enjoy. The human skeleton system is a complex system made up of bones, joints, cartilages, and ligaments. Your skeleton is divided into two divisions, one being the axial skeleton, which includes the bones in the skull, the hyoid bone, thorax, and the spine. Number two, the appendicular section, which include bones in the upper and lower extremities. The functions of a bone, they support the body, they protect our organs, allows the body to move and function like it should. They also store minerals, especially calcium. Hemopoiesis is no more than the manufacturing of blood cells or blood cell production. The normal human body has 206 bones from the top to the bottom. The periosteum is the tough outer membrane of the bone. The bone also contains circular rings of tissue called the Haversian system, which contains the bone cells, or the bone marrow. You have the red bone marrow, and then you have the yellow. The bones contain the marrow as well. The axial skeleton is made up of 80 total bones. The upper extremity part of the appendicular skeleton includes 64 total bones. The appendicular lower extremity section has a total of 62 bones, and the total appendicular skeleton, upper and lower, contains 126 bones. And when you bring all those together, you get the final number of 206 bones. There are a few types of bone cells, a couple of those being osteocytes, which are functional cells in the bones, which are hardened by calcium. Osteoblasts are bone-forming cells, so therefore when the baby, an embryo before it's born, is primarily cartilage. When the baby is born, then ossification begins, which is the process of bone formation, making from when the baby is born, made to a child, a toddler, then to a child, then to a full-grown adult. A mature adult has mainly bone in the body, other than a few sections, which would be the outer ear, the nose, the voice box, and points where bones attach is cartilage. However, the rest of the body is bone. The axial skeleton supports the bones in the skull, the cranium and facial bones, the hyoid bone, which helps hold the tongue and the muscles, and the thorax, which includes the ribs and sternum bone, as well as the spine, which are the vertebrae and discs in your back from the top of your neck, the cervical region, all the way to the coccyx, which is the tailbone. The appendicular skeleton contains bones both in the lower and upper extremities. There are two subsections to the appendicular skeleton. With that being said, the upper extremities and lower extremities, as mentioned before. Your upper extremities include your pectoral girdle and your upper limbs, which would be your arms, fingers, wrists, hands, etc. The lower extremities would be your pelvic girdle and lower limbs, legs, feet, toes, or phalanges. Arms, fingers, wrists, hands, collarbone, and shoulder blades in the bones of the lower extremities make up the total upper and lower appendicular skeleton. The appendicular skeleton does include your fingers, forearms, shoulder blades, pelvic bone, hips, knees, shins, and feet. The axial skeleton has, like I mentioned, all of your ribs, your spine, your full skull, and the part of your pubic area. There are two types of bones, one being the sutural bone, which are small pieces found between cranial bones. The cranial section is where your brain is encased, or where your brain is located, if you will. The point at where the cranial bones meet are called sutures. kind of brings to remembrance when you're embalming a body. You have the incision, and you are suturing at the end. You're suturing the incision closed when you're finished. Small stitches. Number 2 being the sesamoid bones. Small bones that resemble sesame seeds, just in which the bone got the name, and are occasionally found in tendons. The kneecap would be an example of a sesamoid bone. The skull has 3 parts: the cranium, the face, and the ear bones. There are 8 total bones in the cranium, 14 total bones in the face, and 6 total bones in the ear. Again, the cranium surrounds the brain, or is where the brain is located in the middle. There are many bones. There's 14 bones in the face. You've got the frontal bone, the parietal bone, the lacrimal bone, the temporal bone, the sphenoid bone. There's nasal bone, palatine bone, nasal septum, maxilla, alveolar process of maxilla, and the mandible, and that's just to name a few. The face is the second subdivision of the skull, containing 14 bones, as I mentioned previously. You have your nasal bones, which make up the bridge of the nose, the lacrimal bones, which make up your eye sockets, part of your eye sockets, the vomer bone, located in the midline of the nasal cavity, your zygomatic bone, which is the cheekbones on both sides. The palatine bone forms part of the roof of your mouth. The maxillary bones, also known as the maxilla, form both upper jaws. Alveolar is where your teeth are embedded in the bottom. Mandible is the lower jawbone. Your mental eminence is the tip of the chin. The mandibular condyle fits into a depression on the mandibular fossa. Inferior nasal concha is the ridge located on the wall of your nasal cavity. You have 3 pairs of tiny ear bones called auditory ossicles. Number 1, the malleus, is the hammer-shaped. Number 2, the incus, is the anvil-shaped. And number 3, your stapes, is the stirrup-shaped. As you can see in the picture, the malleus attaches to the incus, and then the stapes is on the bottom at the very tip of the incus. The hyoid bone is the only bone in the body that does not connect to another bone. It's connected with tissue and muscle and cartilage. It's right above the voice box, and there's about just a few inches of section before you get to your trachea below the hyoid bone. In your vertebrae or the spine, there are 26 vertebrae that make up your spine, and they're stacked, if you will, on top of each other with a cartilage in between. Of those 26 vertebrae, they are divided into several groups, 3 groups to be exact. Number 1, your cervical. Number 2, thoracic. And number 3 is the lumbar. Looking at the cervical, there are 7 vertebrae in the neck, which make up the cervical area. C1 and C2, which are the atlas and the axis, and connect together, which allow the head to move side to side. The thoracic section is the upper back, if you will, and there are 12 vertebrae there, T1 through T12. Connecting to that is number 3, the lumbar region, which there are 5 vertebrae in that section, L1 through L5. You have 7 sets of ribs connected to the sternum, and they are called the true ribs. We have 12 ribs on each side, making 24 total. The 5 bottom pair of ribs do not connect to the sternum, and they are called false ribs, although they are all still ribs. Ribs number 11 and 12 are called floating ribs. The top of your neck, the first 7 are cervical, the next 12 are thoracic, the last 5 are the lumbar section, which is 5. You have 5 there, 5 vertebrae down in the sacrum, and then 4 fused in the coccyx, as well as 5 fused in the sacrum. Joints in the skeleton. A joint is the point at which 2 bones come together. You have 3 different types of joints. Number 1, you have the center thoracis, which is an immovable joint, no movement. An example of that would be cranial sutures. They do not move. They're stuck in place. The amphiarthrosis is they slightly move, and a good example of that would be the pubic symphysis. It moves slightly, but not much. And then at the end, number 3, the diarthrosis is a freely movable connection, which would be your hip, knee, elbow, shoulder. Obviously, our hips allow us to walk, our knees allow our legs to bend, our elbows allow our arms to move, and our shoulders will move either way with those joints. Are cushioned with cartilage. A lot of times you have to have knee replacement. If the cartilage in between the knee is gone from the knee connected to the femur, if that's gone, you have to have a knee replacement. Not the two bones rub together. Given with that information, that is a diarthrosis. They freely move. With that being said, that comes close to the end of my PowerPoint, and I hope that I got a little bit of a valuable lesson out of each slide. Thank you.